Welcome to Mediocre EMS. Our reach has grown over TikTok and YouTube. We have a lot of followers, and we figured we make comedy, but maybe we should use our reach to help some people. So stay tuned for an educational video.
Hey everyone, I'm Manny, and this is my partner Scott. Welcome to Mediocre EMS, where we take your health seriously, even if we don't take ourselves seriously.
Today we're talking about something everybody has, but not everyone understands. Blood pressure. It's one of the most basic vital signs, but it tells us a whole lot about your heart, your vessels, and your overall health.
We're going to break down what blood pressure is, why it matters, what those numbers mean, how high is too high, and we're even going to show you how to take it properly, at home or in the field.
All right, so let's start with the basics. Blood pressure is the pressure or force of your blood pushing against the walls of your arteries. It's measured in millimeters of mercury, or mmHg.
You'll always hear two numbers. The top number is called the systolic pressure. That's the pressure when your heart contracts and pumps blood out of your arteries.
The bottom number is called diastolic pressure. That's the pressure when your heart is relaxing between beats and refilling with blood.
Let's use an example. If someone's blood pressure is 120 over 80, that means their systolic pressure is 120 millimeters of mercury and their diastolic is 80 millimeters of mercury.
Blood pressure is a vital sign, literally. When it's too high for too long, it puts strain on your arteries, your heart, and even your brain, kidneys, and eyes.
High blood pressure or hypertension is a major risk factor for heart attacks, strokes, kidney disease, and more. And the scary part, most people don't even feel it.
It's called the silent killer for a reason. You might feel totally fine, but meanwhile, that pressure's doing damage every day.
So what's normal and what's not? Let's break it down real quick using American Heart Association guidelines. Normal, less than 120 systolic, less than 80 diastolic, elevated 120 to 129 systolic, or diastolic less than 80, stage 1 hypertension 130 to 139 systolic or 80 to 89 diastolic, stage 2 hypertension 140 plus systolic or 90 plus diastolic, hypertensive crisis 180 plus systolic or 120 plus diastolic. That's 911 territory.
And remember, both numbers matter. You could have a normal systolic and a high diastolic, and that's still considered hypertension. All right, let's get hands-on. We're going to show you how to take a blood pressure the old school way using a manual cuff and a stethoscope.
First, make sure that the patient is sitting comfortably, arms supported, feet flat on the ground, and not talking. They should rest quietly for about 5 minutes before you take it.
Wrap the cuff snugly around the upper arm. The lower edge of the cuff should be about an inch above the crease of the elbow. Make sure the arrow or artery marker is over the brachial artery.
Now place your stethoscope over the brachial artery. That's just inside the elbow crease. Pump the cuff up to 30 millimeters of mercury above the person's normal systolic. Or if you don't know, go to 160 to 180 millimeters of mercury.
Now slowly release the air at about 2 or 3 millimeters of mercury per second. You'll start to hear tapping sounds. Those are the tapping sounds made by turbulent blood flow.
The first tapping sound you hear, that's the systolic pressure. Keep releasing. When the sound disappears, that's the diastolic pressure.
And there, you've got your reading. Write it down and always note the time and which arm you used.
Manual is awesome, but let's be real, not everybody has a stethoscope or knows how to use one. Automated cuffs are more common at home, and they're fine as long as they're used right.
Same setup. Sit, rest, feet flat, no talking. Place the cuff on bare skin, not over a shirt or a hoodie, and keep the arm at heart level.
Hit start, and the cuff does the rest. You'll get a digital readout with systolic and diastolic, and often your pulse. Some even save your data for tracking.
Just be careful with wrist cuffs. They tend to be less accurate than upper arm models.
Tips for accurate measurement. All right, let's talk about some do's and don'ts for getting an accurate blood pressure reading.
Some don'ts. Don't drink caffeine, smoke, or exercise within 30 minutes of taking your pressure.
Do. Sit quietly, legs uncrossed, back supported, arm at heart level.
Some more don'ts. Don't talk, move, or check your phone during the reading. Even small movements can throw off the results.
And always measure around the same time each day, especially if you're tracking trends.
If you ever see a reading like 180 over 120 or higher, especially with symptoms like chest pain, shortness of breath, confusion, or vision changes, that is a medical emergency.
Call 911. No questions. That could be a hypertensive crisis, and it's not the time to wait it out.
And even if you're not in crisis, if your blood pressure is consistently over 130 over 80, talk to your doctor. Lifestyle changes and medications can make a big difference.
Blood pressure is more than just a number. It's a direct line to how well your heart and vessels are doing.
Whether you're a healthcare pro or just someone looking to take better care of yourself, knowing how to monitor blood pressure is a powerful tool.
If you learned something today, give us a like, share it with someone who needs it, and don't forget to subscribe for more health hacks from Mediocre EMS.
And remember, we might be mediocre, but your health doesn't have to be.